Okay. Hello, good evening, everyone. Welcome to the orientation session for part one of MRCPCH at Target MRCPCH Academy. I guess more people will join as time goes. Anyways, we will start our orientation session. So I am Dr. Harshavardhini. I'm one of the mentors here at Target MRCPCH. We are also joined today by another mentor from our academy. Dr. Balaji is also here. Hello, sir.
Yeah, ma. Good evening, ma. Good evening.
Yes, sir. Uh, so we'll just quickly go through the basics of what MRCPCH is, what part one is and all. If anyone has any doubts, please feel free to switch on your audio and ask us any questions you have. So this is our orientation session. We, like you all, most of you already know, we have a separate WhatsApp group for part one, specifically for FOP and TAS, where we can have active discussion. There will be approach, especially discussion of recall questions, because many recalls come, in subsequent exams for part one and part two, like basically theory exams for MRCPCH. We'll also try to put as many questions as possible in the WhatsApp group so that you guys can, practice, and will always have the touch with the exam. So going into basics, what is MRCPCH? So the full form of MRCPCH is it's member of Royal College of Pediatrics and Child Health. It is basically, if you take it plainly, it is actually a degree that is given by the United Kingdom, the UK, post your basic medical qualification, which is MBBS here in India. So it is the one of the pathways to GMC registration. GMC is their medical council. So it is one of your pathways to medical council registration and to practice at UK. It is a degree which is internationally recognized in majority of the countries. Of course, the United States and the Canada don't accept it. They prefer their own degrees. But it is recognized in India. It is recognized by the National Medical Council. And in some countries like Malaysia or even the UAE, maybe it is only post graduation degree uh, in many countries. As in, they don't have their own separate post graduation degree. For them, for you to become a pediatrician and practice in their own country, you will have to do MRCPCH. So it is actually being taken widely by so many of doctors all around the world. Just that we need more awareness about how important it is and how good it is for you. So the basics are, there are three parts in MRCPCH. The first two parts, part one and part two, are theory. The part three alone is clinical. So the part one itself has two papers. One is called FOP, or Foundation of Practice, and the other is called TAS, or Theory and Science. Part two is called, there are two papers again in part two also, and it is called AKP, or Applied Knowledge in Practice. And both the papers are called AKP1 and AKP2. Like in part one, each paper has its own different names, but in part two, both papers have the same name. And part three is clinical. Though their clinical is so much different from what we all are usually used to, as in we are used to 40 minutes of long cases, wherein we can sit and ask history and examination. But here they'll give you only 5 minutes to do an examination. I know they will have their own structure and their own format, which you can fit into those 5 minutes. Similarly, they allow you to take history only for like 15 minutes. Again, they have their own structure, their own format. So the clinical is quite different from ours. Theory paper is mainly multiple choice questions, though I'll come to that later. So the eligibility criteria to apply for MRCPCH, the basic requirement is you will need a medical qualification like MBBS or an equivalent. So this is verified, that you have a medical qualification is verified by submission of a soft copy of proof for that for the same. Usually you are supposed to create an account in the RCPCH website. Again, I have slides for all that later. So at that time, you will upload your proof for primary medical qualification, which will be verified by the RCPCH, the Royal College, with your college or university that you do this qualification. Only then it will actually be approved. Okay, so this part is quite important. And another thing in eligibility criteria is clinical experience in pediatrics is recommended, but it is not mandatory for FOP or TAS. It is preferable for AKP, part 2, and it is needed for clinical part 3, but then it is not mandatory for part 1. That again is a big advantage, because if you've only finished MBBS, you've only completed MBBS and you're struggling through, to go through NEET PG, and some of us might think of going, towards another alternative, but then MRCPCH might be actually a very good alternative when you consider it that way. Okay, so theory exams. Theory exams are usually taken on a computer at a test center, as in it is only multiple choice questions. It is not like, essays and short notes or, short answers or anything. So it is usually taken on a computer at a test center, but post-COVID, it was like an at-home test also, which they are trying to phase out. They give that only in host countries where there are no test centers, or in cities where there are no test centers. You belong to probably some remote city or village other than the usual Delhi, Mumbai, Kolkata, Chennai, Bangalore, Hyderabad. I mean, there are many more centers like that, but then you're not there anywhere near those centers. Then you can opt for home, writing the exam from home. But then they again have lots of rules, like you will have to have another device through which they can watch you throughout the exam. Like those, there are lots of rules like that. And usually the theory exams can be taken in any order, a non-sequential, but then only if you finish both the theory exams, you can appear in clinical. But for the sake of ease, for you to prepare better, for you to have better concepts, it is always easier to do the part 1 first, followed by part 2. And each exam, part 1 or part 2, each exam usually happens 3 times in a year. Okay, it's in the Jan, Feb, May, June, and then September, October times that you will have these exams. So the part 1 has 2 exams, foundation of practice and the theory and size. About foundation of practice. So foundation of practice, this exam mainly assesses the candidate's knowledge, understanding, and clinical decision-making abilities. As in, how are you able to understand the concepts and how are you able to apply it in your clinical decision-making? It is like about how you can apply your basic sciences into each case scenarios. That's how it is. And this exam alone will be for 2 hours. There has been a recent change in the pattern of the examination. Like they have only single best answer type of questions, as in from the multiple choice questions, there will be 5 choices that will be given, and whichever is more correct, not the only correct answer, whichever is more correct compared to the other 4 choices, you will have to choose that. And like that, there will be a total of 100 questions. Previously, there was also another type of questions, similar, other than the single best answer type. It was called extended multiple choice questions, wherein they used to give some 8 to 9 questions. I mean, 8 to 9 choices, along with 4 to 5 scenarios, and you will have to choose each, one answer from the 8 choices for each scenario. Like that. Anyways, we don't have that. They thought that it was too complex. RCPCH thought it was too complex to give it for a basic theory exam. So they've skipped it now. It is only single best answer type of questions, wherein you'll be given 5 multiple choice answers, and you will be asked to choose one which is more correct compared to the other 4 for the scenario or for the question that is given. Pass is based on percentile that is set for each setting. It varies from exam to exam in the same year. I already said that the same exam, FOP, you can take it anytime in 3 times in a year. And the percentage changes for each time. Usually it is around 60 to 65, but then it depends on how difficult the paper is and how many people have taken the exam, and there are lots of other factors that they put in. Next is theory and science. In theory and science, it is mainly scientific, physiological, and pharmacological principles. So here it is mostly like basic science, how you can understand physiology and how it works in whatever disease scenario or whatever case scenario that is given. Similarly, pharmacological principles, how do you apply this mechanism of action or this drug-to-drug interaction in this case scenario that is given as a question to you. All those basic science questions mainly comes in theory and science. I think the name itself, gives you an idea of what it is. Again, this is also 2 hours exam and single best answer type of questions. Same 5 multiple choices will be given, among which the more correct or choice among the 5 has to be chosen. And there are a total of 100 questions. Again, here also the pass is based on a percentile that is set for each sitting. The theory and science percentile is usually lesser compared to, the pass percentile is usually lesser compared to foundation of practice. This is usually around 55 to 60, though it completely varies exam to exam. And the reason why is that basic sciences is something that the RCPCH feels we are not strong enough in, not just us. People overseas everywhere who gives exams. So they've kept the percentile pass mark for theory and science a bit less compared to foundation of practice. Till now, if anyone has any doubts, because next we'll be going into how to create an account and how to book an exam and all. Or if Balaji sir has anything to add to whatever I've talked till now.
Nothing much, but the one good thing which I liked is even if we have not completed an MD degree, still there is a scope that they can give the MRCPCH. So it's a separate degree. So those who have finished a pediatrics degree, they are at an advantage because they have the background knowledge to clear. So the preparation time can be a bit lesser. But those who are MBBS, still they can also, if they prepare for a good amount of time, they can also clear MRCPCH. So that's the good thing. But clinical experience is important for the third part. For the third part, they need at least they should have worked in a setup in pediatrics, and they don't require you to complete MD pediatrics to give the exam. So that's the good part. So even if you're studying in MD, that they are also good candidates to start preparing for MRCPH. Yeah.
Yes, so
We'll
true.
continue.
Okay. You can, if you have any questions, please ask in the chat box also.
Yeah, you can post in the chat box. We can keep clearing in between.
So how to apply for MRCPCH? Usually you will have to go to the RCPCH website and create an online account through registration in the website. So in when you fill details, you'll usually ask your name, last name, surname, and then your address, the country where you are from, and what basic medical qualification you have. And they will also ask you to submit proof of primary medical qualification. So here, if you have finished MBBS, then you will have to upload your MBBS degree certificate or MBBS degree certificate has to be uploaded. This, like I said, this will be verified with your medical college or the university where you studied. And then once that is done, that is part of the process that they do for screening your registration. Usually you can apply throughout the year anytime, and it takes at least 10 working days to process the registration to verify with your medical college or the university, and then verify all your other details. They take at least 10 working days. Hence, it is usually recommended to create the account between exams or diets. Each sitting is called diet. In RCPCH language, each sitting of an exam is called diet. For example, if you have January, February exam, then that is called diet 1. Similarly, May, June exams are called diet 2. Similarly, September, October exams are called diet 3. Like that, they have 3 diets. So because you have exam in Jan, Feb, and May, June, March, April is the free time. So it's usually recommended to create an account during March, so that the time doesn't overlap with exam application time, and they can process it better. Once your registration is done, the process is done, an RCPCH number will be allotted to you. You will have to remember that number, use that number for logging into your account. That number will act as your username in the RCPCH website for you to go to, use your account. And it is needed for all exams. And how to book an exam. You have to get to the exams booking system by going into, you'll first log in with using your RCPCH account number and whatever password you've chosen. And then you will have to go to my account and go to available bookings. There it will show FOP TAS India or FOP TAS United Kingdom or whichever country you are from. And that you can choose. Usually what RCPCH does is, in its website, it will post the exam dates along with application window when the application will be open. For example, if your exam is in February, usually the application window will be during December. and it's only 1 or 2 days. Once you open the exam application, you'll have to enter whatever relevant information is required, again as in your name or when do you want to give the exam and all, and then you'll have to submit the form. Once you submit the form, a confirmation email will be sent after reviewing your application. The most important thing here is that fastest finger first. Okay, you'll have to register early to secure a preferred exam location. For example, there are only very limited seats. It used to be only 50 to 75 seats. And the moment it opens, maybe around 2:30 p.m. for Indian time, or the standard is 9:30 p.m. UK time. So it will be around 2:30 to 3 p.m. Indian time. So by the time it opens, everyone, will be sitting with their laptops or mobile or whatever devices, and everyone will book it off. It's almost like you won't have a seat even if you, open it 5 minutes late. So it is literally fastest finger first here. So that, you will get a slot this time. That is why we usually say that you start your preparation before itself. Do not wait for the application window, or do not wait for you to get a slot. If, for example, if you're planning to give your exam in February for part 1 FOP or TAS, then starting it from November, the 3rd or 4th week will be the ideal time. So you will have to start your preparation. Meanwhile, wait for the window to open and do it off. And payment has to be done right then and there when you are trying to register for the theory exams. For payment, it is international debit or credit card is the one that is usually preferred. So make sure you also have the card with you ready beforehand. So these are a few things that you'll have to keep ready when you are keeping yourself ready to book an exam.
So we need to register first for an RCPCH number. So register your account first. Then the booking will open later so that you will be ready. Then you can book your exam. And while booking, it has to be like, it's like booking a movie ticket only. So you have to book fast. So if you're late, you will not be able to book. Someone would have booked. So that is the problem. You need to have a good internet. And actually, I remember I had an issue. So I had to talk to UK, the MRCPCH person, to get it corrected. So you should be ready to contact them. If you wait for the issue, then you might lose the booking. So you need to be a bit quick at that point of time. Okay, doctor, you can continue.
Yes, sir. So someone had asked, what is the fees for registration for part 1? So this is the current exam fees. I hope my screen is visible. This is the current exam fees for each papers. Usually it is preferred to give FOP and the TAS both papers together. Again, one thing is it saves money, and second thing is it is not easier to do both together. So I've put some sample questions here. This is for FOP, Foundation of Practice. The question that is given, actually the sample papers are available in the RCPCH website itself. You can see here that I've taken this from the RCPCH website only. So the question reads like, a 13-year-old boy is concerned that he is not developing any changes of puberty like his friends at school. He attends with his father and an examination has normal prepubertal external genitalia. So what will be the first sign of puberty? You can see that the case scenario is about puberty, that's all. But then the question is about, foundation of practice. How we are able to apply your theory to this, because they've given prepubertal external genitalia. So they want to know what you will look for. For that, they've asked the question, what will be the first sign of puberty? So questions will be only like this. Similarly, second question in FOP again. You're seeing a boy in the primary care practice when his 10-month-old sister suddenly starts to cough and gag while eating grapes. After a short time, she becomes quiet and is cyanosed but conscious. You shout for help. What is the most appropriate initial action in managing this child? So which one of these you want to do? Basically, what they're telling is that you're already in a clinic setup or hospital setup. The child is cyanosed. Right in front of you, everything is happening. So they want to know what you would do next. So this is an infant. That also we need to remember. It's a 10-month-old child. It's an infant. So what you would prefer is giving 5 blows to the center of her back. If this was an older kid, then you can do the Heimlich maneuver. So these are few things that we are bound to make mistakes. The moment we look at the word Heimlich maneuver, we'll think that it is the right answer. But then they have given a clue in the stem that it is a 10-month-old child and not the boy that you are seeing in the primary care practice. So these are all places where you can easily make mistakes, but then places where if you just were extra careful, you can easily score marks because this is actually an easy question. And this is for TAS, Theory and Science. So you are an ST2 pediatric trainee. This ST2 and all is called specialist trainee. And these are words or hierarchies that are used in UK. Specialist trainee 1, 2, 3 are usually said to be equivalent to any post-graduation years. ST1 is PG first year, ST2 is PG second year, and so on. So when you're actually doing your MRCPCH clinical, you are supposed to be equivalent to a specialist trainee in their third year. That is how they will assess you also. So the scenario that is given here is you are an ST2 pediatric trainee. A staff nurse has contacted you to inform you that she has just administered a 5-fold overdose of vancomycin to a 10-week-old baby on the pediatric ward. So what is the most likely side effect in the next 24 hours? Basically, they only want to know what is the most common side effect of vancomycin. But then they've given scenarios so that you will apply it to the scenario and see what you will monitor. They want to make sure that you will do this when you see the patient in the ward. That is how the questions are framed. A newborn baby boy presents with irritability and poor feeding. Gram-negative bacilli are identified as CSF, which is the most likely cause to organism. Again, it is more like what's the most common organism causing meningitis in a newborn. But then they haven't put it that way. They want you to apply basic science, theory and science in their clinical scenarios. So usually these questions will always have a case scenario tagged along with it, and there will be some basic science question. I hope these sample questions give you guys an idea of how questions will be put up. Yes. Anyone has any doubts?
So basically, in the foundation of practice is about clinical decision making. So they start with a case, and what decision are you going to take to that case? So there might be number of choices. You will have the background knowledge of how to manage and all those, the guideline, everything. But for that case scenario, how are you going to apply? What is the choice of treatment? All the 5 choices might be relevant depending upon the scenario. For example, we saw, no? So for an infant, what procedure you will do will be different. And for a child, with the procedure which we will do will be different. So you have to choose that decision. So that is foundation of practice. But in theory and science, it is the same case scenario will be there, but the background physiology, anatomy, pathological principles will be tested. So that is the difference between both. So here the basic science they take. So they're not going to go into the management or investigation. And FOP, they will be asking about what investigation and what management part, what decision you are taking. So that is what they're looking. Okay. You can continue.
Okay. Yes, sir. So just an overview of our course. The course duration that is planned for the upcoming MRCPCH Part 1 FOPTAS exam is 2.5 months. And the advantages of taking our course, it is there will be a comprehensive preparation for the MRCPCH Part 1 exam, along with better understanding of concepts. And we'll even give access to essential study materials. Whatever study materials are relevant, those will be shared. Similarly, we'll try to simulate exam conditions with practice exams. Sorry, does anyone have anything to ask? Yeah, so like I had already mentioned, we will try to post questions in the WhatsApp group to, so that you guys can keep answering and keep practicing. Similarly, we will try to, conduct exams that can simulate the actual exam conditions. Other things will be, we will also have live Zoom sessions wherein we will be discussing all the recent recalls and whatever doubts you have, it will be system wise. Whatever doubts you have, you guys can get it clarified during those live sessions, and recordings will also be available so that whatever concepts are being taught to you, those you can go back and review later for better understanding and for quick revision. Uh, One thing is that whatever recalls that are usually available online, they won't have the exact case scenario. It is only whatever, the candidates who finished the exam and came out, whatever they can remember, only those will be put. So it won't be the exam case scenario. So that what I'm trying to tell is it may not give you the whole information on what exactly the scenario was or what exactly the question was. So maybe you can use other apps or other subscriptions wherein they will give actual case scenarios and there will be questions, so that you'll have better simulation of actual questions and better simulation of actual exam. Because the exam stress itself is a different thing. Most of us, I think, are used to only writing long essays and long, short notes and all. But to think on the spot for all these multiple choice questions and train yourself to answer, especially within 2 hours for 100 questions. It is similar to NEET UG and NEET PG, yes, in a lot of ways. But then, since you can see that most of those questions are only case scenarios, there is no, a majority of them won't have a single question with a single best answer. It is only whichever answer is better, as we already saw in here. So it will take your time. It will make you think. And one more thing, they put 2.5 hours here, but then that was when there was extended multiple choice questions. But once they removed the extended multiple choice questions and there is only single best answers, they changed the time to 2 hours.
So here I would like to emphasize the method of preparation. So you cannot be reading the whole book and put the knowledge alone and go and straight away sit for the exams. So a lot of questions are repeated. So looking into the recalls are very important. MRCPCH have their own focus areas. For example, non-accidental injury. So they are very much concentrating on non-accidental injury, meningococcus. So like that, they have their own topics. Ethics, they concentrate much on ethics, which we are not much fluent. So they have their own concentrated topics. So you have to look into the recalls, and based on the recalls, you build upon the knowledge surrounding those recalls. It's not advisable to read whole books from now. So it's advisable to look into the recalls at least three to even if you take 3 years recalls, you will have 3 papers. Na? So at least 10-year paper will be available for FOP TAS. So look into the recalls and build the knowledge surrounding those recalls, because the recalls only are going to repeat it. Only the format, the case scenario will be a bit different. The choices will be certainly different. So you have to read, acquire the knowledge, and be ready to answer the question which is reframed in a different manner for the next exam. So that's what your aim or goal should be, rather than reading the whole book from top to bottom. Okay. Yeah. I think since small group is there, you can switch. You can talk. If you have any doubts?
Okay. So there are a few questions in the chat. I'll read them. So one of them has asked, I'm currently a third year PG giving exams so you're probably giving your third year exam in June 2025. It's been 2 years since you last studied basic sciences for NEET PG. So should I write FOP TAS first or AKP first, as I'll be reading pediatrics for my finals, is the question. Okay. One thing is, yes, sir.
In
Yes,
this,
sir.
I feel that they usually say that if you have a clinical knowledge for a clinician, uh, AKP will be the first choice. So you can take AKP first because they have the experience. They would have seen the cases. So if you have the clinical stronger, if you feel that your clinical concepts are good, then AKP is good. But if you want to start from scratch, so you read the basics, and anyhow you will be reading, you have your own basics paper will be there for exams. So then I think theory and science will help you, because anyhow the basics paper will be there for PGs, no? So that will be good. What do you say, doctor?
Yeah, yes, sir. That's what I also felt. Anyways, you will have to read basic sciences for your final university exam also, both for theory and the practicals. So maybe you can give your part one in the, FOPTAS in February. So that will be like a brushing up of all your basic sciences. Both for, you can give, once you brush up basic sciences, you can give the part one exam in February, and then that will be obviously useful for your exam in June 2025. And then whenever once you've studied for your final exam, you will be ready for applied knowledge and practice or part 2 of MRCPCH. So then you can give it whenever you're ready, maybe even in June, or once you finish your third year exam, your final exam, you can give it in September also. Okay. Another question is, where can we get the past question papers?
Yeah, it's available in Telegram also, doctor. A lot of Telegram groups are there. We can share you the groups. And in anyhow, we will be posting in the group regularly the questions. And most of our discussions which we are going to have every week is surrounding the recalls
कम तो
only,
ये पहले से हैं।
past papers. So most of our discussions in the classes, weekly classes which we take, will be surrounding the recalls only, past papers only. So we'll be discussing. So we'll be posting regularly the questions in the WhatsApp group. Whoever is joining the course, we'll be forming a WhatsApp group. So there, every day we will be posting recall questions so that you can practice. Okay.
Yes. So someone has asked, is a past test subscription necessary? So like I was telling previously, since recalls won't have the exact case scenario that is actually asked in the exam, if you want exposure for that, then subscriptions might be, required. A past test subscription might be necessary that way.
But actually, again, same thing only. So all the past test questions actually are unofficially available in many Telegram groups. So you can get them. Uh, we can always share the groups also, not an issue. What I feel is the past test questions are framed in a good structured manner. So you have a big case scenario. So that is there. The recalls will not have that structured question for you to practice. But the problem is recalls only will be repeated again. The pastest questions will not be coming for your repetition. It's only for you to have an approach, look into the question, try to analyze, try to answer. But those questions from pastest are not going to come straight away for your exam. But the recalls are, there is a high chance of getting repeated again and again. The theme and all will be coming again and again. Okay. And some say that for TAS, theory and science, pastors is not so good. Okay. So that also we should keep in mind. Not many questions get repeated for theory and science. Okay.
So continuing what we were previously talking about, someone doing their final year post-graduation, is reading for FOP and TAS possible while doing residency, as I only get a few hours free away from work? Okay, so that is actually a good question, because many postgraduates do like to, do the MRCPCH exams parallel to while they do their post-graduation. But then it completely depends on your institute and how, how much work you have as a final year postgraduate. If you can make time, because like I already said, basic sciences are anyways required for university exam. And based on whatever I said as an example, you'll have your exam only in June, but then you can probably give your part one exam in February itself, which means there is quite time, quite some time between your final exam and this. So you should be able to cope. It completely depends on your time management, I think.
Yeah, I think our two of our postgraduates in our hospital have completed actually. So they are from a private college only. What they did was step by step. They took only one at a time. So I think if you feel that way, that taking two at a time has advantage of money. So you save money, and advantage of not reading for a long period of time. So you take one part, then another part. You have to spend a lot of time in that. But if you are having this issue of time, you are unable to spend at least you are unable to spend much time, then take one part at a time. So that will be better. And maybe if you are seeing cases, I think foundation of practice will be better. So you have all the case scenarios. And for a task, you have to go back and start reading some concepts of physiology, pharmacology, anatomy to answer. So you need to prepare something more for task. But for FOP, I think your background knowledge, whatever you are seeing, already you have been reading, so the guidelines and all is going to help you up. So the background knowledge will help you in clearing the FOP. But for tasks, you have to spend some more time. So that's what I feel.
Another question is where to get study material for FOP and TAS.
Yeah, that we will share in the group, doctor. So we have RCPCH approved books are there. So the theory and science of pediatrics. So it's a very good book, Science of Pediatrics. Then illustrated book of pediatrics. So those two books are very important. Plus guidelines. So I think we will share in the group for you all, so you can start preparing. And one more is I'm planning to do neonatology fellowship. Will it be helpful post MRCPCH? Yeah, doctor. So uh, MRCPCH is always it's an internationally recognized. We have been doing the clinical part actually. So many neonatologists all are giving actually MRCPCH. So once you are going outside, so that MRCPCH in Middle East and all they consider for consultancy. So it adds to your thing, even if you do, because fellowship is always it's a 1 year course, no? So it's not internationally recognized, but MRCPCH is internationally recognized. So it will always add to it. And many of our candidates, we have given mocks and coaching for neonatologist also.
Also, psychologists, cardiologists, intensive who've been taking with us. Sir, can you mute? Yeah. Okay. And I think one main thing is it depends on, MRCPCH, what you want to do, how you want to branch out after you finish your MRCPCH. Advantage of doing MRCPCH if you are going to be in India is that it is very much welcomed in corporate hospitals. These days, it is even being welcomed in medical colleges because MRCPCH is being recognized by the RNMC, National Medical Council. And like Balaji sir already said, if you want to work in the Middle East or in the UAE, MRCPCH along with the fellow, MRCPCH is more preferred for consultancy compared to our MD or DNB degrees. And if you have a fellowship along with MRCPCH, then that means, they prefer you even more for, the consultant post. That's one thing. And in United Kingdom, though, like we already know, a fellowship is not recognized, but then they will definitely take your experience, whatever duration you worked, 1 year or 2 years in neonatology, as your experience in neonatology, and they will give you specialist post in neonatology once you've completed your MRCPCH. So there are advantages of doing MRCPCH, no matter where you want to continue your practice, whether you want to stay back in India or in your home country, or you want to go to the Middle East or UAE, or you want to go to the UK. You have a lot of options, a lot of exposure, a lot of scope once you do MRCPCH. Okay.
Is reading only the material you give enough for FOP and TAS? Actually, um, we are going to add. So most important will be reading the books. Actually, the books which we are going to share in the group and the standard books. So that you have to read. So the theory and science of pediatrics is very important. And for FOP, the guidelines are important. So we have pediatric guidelines, you have neonatal guidelines. So those guidelines are important. Those books are important. And also the cases for TAS and cases for FOP. So the RCPCH have released official two books for cases in TAS and cases in FOP. So those 50 cases are very important. Plus the recalls. Very important is the recalls. So what we will be doing is discussing mainly the recalls. And while discussing the recalls, we will be building the topics surrounding those recalls. We will try to highlight what important topics, so we will give the important key points so that you can be able to answer those topics better. Okay. But reading the books are more important. So that is important. And doing the recalls are very important. Okay.
Because the books that we have been mentioning are oriented towards the MRCPCH exams, rather than your own post graduation books, which will be very broad and there'll be more information. These books that we are recommending are more oriented towards how you want to read for or prepare for MRCPCH.
All government doctors, there is no bar doctor. Anybody can apply for the exam. And age is no bar. 60 years plus also can write for MRCPCH. So there is no. All you need is an MBBS degree. So you have an MBBS degree, and you can start preparing for MRCPCH. The background knowledge will always help you. So if you have done MD pediatrics, that will be always helpful. If you are an experienced consultant, you go beyond. So the clinical part will be more easier for you. And younger people, the FOP task will be easier. But you prepare and you can always clear all the parts, not an issue.
I think another question is, if we fail, can we write again? So they allow you quite a few attempts. I think it's up to 6 attempts for theory exams. Uh, but you because we have a post graduation background, it is usually easier to prepare for these exams. So we don't think about the concept of failing. We try to make you pass it. The way you prepare, it will be like you can pass. But again, it completely depends on how much of the concept you can understand and how much of the recalls that you can practice, because recalls are the main ones that you'll have to concentrate, especially when you're doing these exams. And the books that we said, like Science of Pediatrics and Illustrated Textbook in Pediatrics, how much you can understand the concepts and how much you can apply those in the exams, those are important. So next one is, sir, I'm busy in my practice, but how much time daily for preparation if I opt for the exam? I think most of the doctors have been giving exams, have uh, entire day packed with practice. Some of them either go to hospitals or medical colleges, and then evening they have a very busy clinic. I think Balaji sir himself is an example. And so I think you can take those as inspiration and do it. But exact time for preparation, if you want to ask like every day, um, again, I would say if you can, like for theory exams, if you can allot some 2 to 3 hours every day, but again, depends on how quickly you can understand concepts and how quickly you can revise and how quickly you can read through. What do you think, Sir Balaj? I think he'll be a better person to answer because he has a very
Yeah, I
busy day.
think three hours we have to spend every day. So that is important. And maybe at the end, 1 week of revision. So we have to take extra time at the end, fag end. But daily, at least 3 hours of preparation is needed because we are spending money also, no? So that is the thing. So almost 700 pounds plus. So we need, or if we are, if you feel that it all depends on our background knowledge. If our background knowledge is a bit less, we have been a bit far away, finished, and then take one part at a time. So you take one part at a time. Then I think that will be 3 hours will be good enough.
Thank you, Dr. Arvind. Any other doubts anyone else has? Uh, we will share our this oriented. We have recorded this session, so we will share this in the group also, so that you guys can go through the whole thing again. And if at all you have any doubts, you can definitely post in the group and discuss and ask.
And this our group will be starting from the second half of this month. So weekly we are planning one class for FOP and one class for TAS. And in between every day we will be discussing, and most important is the doubt clearance. So everyone will be brainstorming with lot of doubts. So that will be helping you to learn better. So that is very important. Okay. Okay, so we will keep continuing our inputs in the groups. Anytime feel free to contact us. So thank you. Thank you, Dr. Harshvardhani. Thank you all. Thank you, Fatima. Thank you, Fauzia. Thank you, Jitendra. Thank you, John. Thank you, Manoj. Thank you, Shahul. Thank you, Sinisha. Thank you, Shreya. And thank you, Uma. Thank you.
I think Dr. Arvind also. Yeah, thank you, everyone. Please do post in the group also if you guys have any doubts. Thank you.